Hey, so I noticed that the patient wasn't taking their oral meds due to Ramadan, and the doctor ordered heparin for DVT prophylaxis. Can you ask the patient if they're aware that it's porcine derived and if they're okay with it? You're in the room with them and they're not okay with it? Gotcha. I'll add it in as a pork allergy and see if I can reach out to get it switched to something else. So patient in 411 does not want to be on heparin since it's porcine derived and they're Muslim. Yeah, Rixtra's an option. Hey, for patient in 312, I saw you ordered a loading dose of Vanc as well as a consult. Just so you know, we actually load patients on hemodialysis the same as we load patients with normal renal function. I fixed it. The maintenance dose actually is going to be a lot lower, and it's going to be dosed after dialysis. It's actually going to depend on if you use low or high flux filters. We use high flux filters here, so it's going to pull off maybe about like 50% over 4 hours. It's also going to depend on if we have ultrafiltration and if the patient has some residual kidney function. Yeah, I saw the INR drop a little bit. So while enzyme inhibitors act pretty much immediately, with enzyme inducers, it's going to take about a week until we see the maximal effects of full induction. Ready dose Zosyn for E. coli bacterium in a hemodialysis patient. So in hemodialysis, we want to do ethacrynic acid instead of Lasix since they have a sulfa allergy. So that cross allergy is actually not a thing. Why is that? Not to go old nerd on you, but you gotta ask yourself, is there an aryl amide? Is it gonna form a nitroso intermediate that can covalently bind to proteins and form an antigenic signal? In this case, no. Okay, yeah, I know that was a lot. Lasix is okay. No, yeah, lorazepam's been on back order. That's why I switched it to midazolam. Yeah, IV lorazepam to midazolam's a 1-to-2 conversion. Yeah, midazolam has a shorter half-life and it also undergoes phase 1 metabolism through CYP3A4. That's why lorazepam's actually preferred in liver dysfunction.